operate the site, bringing the total support provided to more than $2.1 million. We know the pandemic has had a significant impact on individuals experiencing homelessness in particular, and we are pleased to provide this support to ensure that they have a safe space to stay while limiting their exposure to others. In recent months, isolation units for people experiencing homelessness has been operating at 80 to 100% capacity. This additional funding will help to respond to this demand, which ultimately helps to protect all Manitobans from the spread of COVID-19. Our government is also providing $335,000 to provide meals to low-income Manitobans who do not have access to kitchen facilities because they are self-isolating due to COVID-19 in partnership with 2 community agencies. Since December 31st, up to 10 low-income Manitobans per day have been receiving meal packages, including breakfast, lunch, and dinner throughout their isolation period. Manitoba Housing's Food Services provides in-kind support for this program, which is delivered in partnership with Made with Love and Scope. I'd also like to take this opportunity to provide an update on a new training and recruitment initiative launched in November by the Department of Families to support agencies that serve Manitobans with disabilities. This includes a partnership with Manitoba Possible and its online platform called Envoy, which connects agencies with job seekers who have the appropriate training and skills. I'm pleased to announce that almost 2,000 individuals seeking employment have registered with the Envoy platform since the launch of this partnership. My department has partnered with Red River College to develop a 1-week online training program at no cost to the individuals enrolled that is focused on the fundamentals of disability support work. Over 150 participants have enrolled in this training opportunity and will be prepared with the knowledge required to make a positive impact in their role. Lastly, I'd like to take a moment to recognize TELUS. Last April, the corporation donated 120 tablets and data plans to Kids in Care, which were distributed to community organizations that provide group care resources for children. They recently extended their data plans, so recipients will now be able to benefit from them until the end of June. I hope these gifts will help them feel a little more connected with their family members and other important supports as this pandemic continues. So on behalf of the government of Manitoba, I'd like to say thank you to TELUS. In conclusion, I want to assure Manitobans that our government is working hard to ensure that no one falls through the cracks as we face the challenges of the COVID-19 pandemic together. It has been my honor to share this information about these important initiatives with you, and I'd be happy to take your questions.
Thank you, Minister. A reminder to our reporters on the line, you will have 1 preliminary and 1 follow-up question this afternoon. Up first from the Canadian Press, Kelly.
Hello, Minister. So when we're looking at the funds to support COVID-19 isolation units for people experiencing homelessness, how does this add to capacity, or is it just for supporting staff?
So we've added capacity. We've created additional beds for people who are experiencing homelessness that have tested positive and need to isolate. And so we're ensuring that we have beds available. Right now, I was told today that there are only 50% of these beds are occupied today, but that number fluctuates on a regular basis as more individuals come forward for testing. And so we've created nearly 90 beds through the alternate isolation accommodations program. And when individuals are isolating in one of these particular units, they are provided their 3 meals a day by our government, as well as a safe place to stay during their isolation period. In addition to that, we're also partnering with the 2 agencies that I had identified, Made with Love and Scope, who are helping us provide meals to other people who have isolation accommodations outside of one of these specific units. Possibly it could be a hotel room that they're staying in, or a place without a kitchen. And they don't have access to facilities to prepare their own meals, or possibly they just can't go out and get themselves groceries. That is when we are connecting them to the food services provided through the Made with Love or Scope, where we're ensuring that they have their meals delivered right to their doorstep.
And the follow-up to that, for that meal delivery service, it says on the release here that it's providing food to about 5 to 10 people a day. So is this people that aren't the ones from the north coming south to isolate? Who are these 5 to 10 people, and is it expected that it will reach out to more people needing this service?
Yes, absolutely. These are the people that are not in one of those alternate isolation units, because that's a separate meal program for those individuals. These are the ones that are testing positive, need to isolate, but either don't have access to kitchen facilities in their own accommodation, or they're perhaps staying in a hotel, and we're providing that meal service. So right now that has been the need, and we're working very closely with our partners in public health. And when someone comes forward and tests positive and requires isolation units, we're ensuring that they've got a specific meal program available to service their needs, as well as a safe place to stay.
From CTV Winnipeg, Turia.
Good afternoon, Minister Squires. You may have mentioned it, but I just want to clarify. So the isolation units at 80 to 90%, or sorry, 80 to 100% capacity. So that's 90 beds in total. That would be 100% capacity?
Roughly, we have about 90 beds identified right now at a few locations in the city for people who are experiencing homelessness and need to isolate. We have opportunities to ramp up if needed, but thus far we have not needed to ramp that up. And during the first wave of the pandemic, we were sitting at around less than 50% capacity. We've seen it go up to 80% capacity, or 100%, or nearing that 100% capacity. Today, I've been told that we're at 50%. And of course, this fluctuates on a daily basis, because we know that the length of stay that most individuals are at an AIA is about 8 to 10 days. And so it does fluctuate, and we keep a close eye on that and make sure that when someone tests positive and needs to isolate, that those accommodations are available for them.
And as far as the meal program goes, how long is that expected to last?
As long as we're in this pandemic.
From CHVN, Taylor.
Hi, good afternoon. The things you're announcing for support, such as meals and shelter, they're needed regardless of the pandemic, and a lot of people who have been exposed to the virus might even be getting access to these meals and shelter for the first time in a while. What is the province doing to support these basic needs?
So we have got several opportunities underway to support our vulnerable Manitobans and our homeless individuals, people who are experiencing homelessness in our province, working with so many of our community partners through Main Street Project, Salvation Army, Silo Mission, just to name a few. And we have increased some investments for these some of these organizations. We've also worked with other entities, whether it be in Manitoba Housing or other agencies, to ensure housing for all our vulnerable populations, particularly youth aging out of care or on the precipice of adulthood who need housing security, and other sectors who we know are very vulnerable. But this pandemic has certainly created a greater awareness and emphasis and need based on results of the pandemic and other variables. And so we're continuously working to assess the situation and ensure that we are able to provide housing for all Manitobans.
And as a result of a lot of shelters being experiencing reduced capacity. A lot of people are literally sleeping in the streets, bus shelters. What's being done to take care of those folks?
So we have, in partnership with many of our agencies, we are keeping an eye on the capacity in our shelters. And I'm told today there is capacity at all of our shelters. We know as the weekend approaches and our temperatures are going to plummet, that may change. And so we're in continuous dialogue with our shelter partners to make sure that the capacity is available, and we've provided additional supports in many cases to these organizations so that we can continuously meet the need, and really working with other community partners to highlight a few of the organizations involved in working on downtown safety initiatives and offering downtown patrols, who are doing a great service. Our government was very pleased to partner with that organization, who's not only just looking to provide a need, but they're building a relationship to establish trust amongst certain individuals who may be experiencing homelessness and might actually feel that they have a friendship with one of these ambassadors or individuals that they meet from the agency, and will be willing to take them up on an offer for a warm place to sleep when needed.
From the Winnipeg Free Press, Carol.
Hi, Minister Squires. Is there any plan to expand permanent affordable housing for people experiencing homelessness in Winnipeg? If so, when and how?
Thanks so much for that question, Carol. And as you know, our government recently signed the bilateral agreement with the federal government, the National Housing Strategy, and our commitment is to increase our number of Manitoba housing units by 12.5% over 7 years, and continuously trying to work with partner agencies to address emerging needs or needs that are specific. We've recently piloted an initiative to create new units for women and children that are fleeing domestic violence, who are possibly living in one of our shelters for domestic violence, and finding them appropriate housing for them to move into afterwards. We know that one of the main reasons women will return to an abusive partner is lack of housing opportunities, and so we're creating additional units to meet that need, as well as kids aging out of care. We recently were very pleased to partner with the federal government on creating some housing opportunities for kids that are aging out of care. And so we'll continue to be adaptive and flexible to meet those emerging needs on a go-forward basis.
Thank you. And Mr. Squires, you, like many of your cabinet colleagues, oversee agencies, boards, and commissions included in the Premier's edict last night that government appointees not travel for leisure purposes to places not recommended by public health. So in the lead up to the announcement, was your department reviewing the travels of board appointees that you are personally responsible for? And how will you enforce the directive with the boards that report to you?
So I believe your question would be best answered by our health department, but we are just, the message has been very clear and has been reiterated by numerous individuals, including Dr. Roussin and our Premier, that at this point, travel for leisure is not recommended.
From CBC Radio Canada, Matthew.
Hello, Minister. Can you make a short summary of your ad in French, please?
Désolé. I'm sorry. At another time, I could perhaps give you a statement in French later today.
Okay, thank you. No problem. I don't have a question.
Merci beaucoup.
And our final reporter this afternoon, Minister, from CBC Manitoba, Jill.
Hi, Minister Squires. Can you specifically say how many more beds the funding for isolation units will create? How much more capacity will this create?
So the capacity will be expanded to meet the need. We will always ensure that we're working with our public health partners when someone who is experiencing homelessness requires an isolation unit. We will always ensure that they have that capacity. Right now, we have 90 beds available that are being utilized right now, and they're at 50% capacity. That changes on a regular basis, and we're in continuous dialogue with our partners to make sure that if we were to be getting close to that 100% capacity, that additional spaces would be made. We've got those arrangements that could be made very quickly. We haven't had to move in that direction as of yet because the beds that we've made available are able to meet that need. What we've done is just secure these arrangements for a longer period of time because we're not sure exactly when we will be out of the pandemic, and as long as people who are experiencing homelessness are at risk of COVID-19, we will be ensuring that they have these units available to them. And we certainly do want to ensure that they get the vaccine as soon as possible. They are identified as a priority for vaccine distribution, and as soon as Manitoba is in receipt of those additional units, this particular group will receive their vaccines, and hopefully the need will dissipate from there. But like I said, as long as the need is required, we will ensure that these accommodations are available.
My follow-up is, you mentioned in your press release that these isolation units have been operating near full capacity for months now. So why not make this investment sooner to allow the expansion for more beds or more folks?
We've made the expansion available for a longer period of time. That is what today's announcement is about. But we have not ever exceeded the capacity that we've already created. We're just now making sure that it is available for a longer period of time because we don't have a definitive line of sight into when the pandemic will be over.
Thanks, everyone. This concludes our media briefing.
Thank you very much.